Now we are going towards the variants or different types of acne. Different types of acne vulgaris. Here is the topic acne vulgaris, and here are the types, subtypes of acne vulgaris. First is acne conglobata, occupational acne, cosmetic acne, acne after facial massage, drug-induced acne, infantile acne, late onset acne, acne fulminans. One by one, we are going to learn.
I would like to one example of वो जो drug induced acne की बात आई है. So that is the side effect of medicine. So today we got a patient of coughing. So patient, we are treating that patient since 1 month, and patient is not responding to any medication. Patient is cardiac patient. Patient was taking some allopathic medicines for diabetes. No, he was not diabetic. He was hyperlipidemia, hyperlipids tha. So he was on statins and hypertension was there. So he was taking some hypertensive medicine. So when you are giving medication and when medicines are not responding to the patient, in those cases, what will be your first question? What will be arise in your mind? क्या सोच रहती है आपकी? आपने 1 महीने खांसी की दवाई दी, पेशेंट को खांसी मिट नहीं रही है. पेशेंट के ब्लड रिपोर्ट्स करवाए, ब्लड रिपोर्ट्स आर एब्सोल्युटली नॉर्मल. व्हाट विल बी योर थॉट? क्या थॉट रहते हैं आपके माइंड?
There may be any maintaining cause.
ओके.
कोई और ड्रग्स तो नहीं ले रहा है, किसी और डिसीज से वो मतलब किसी और डिसीज से वो पहले ही हो रखा हो, प्रॉब्लम हो रखी हो जिसके लिए वो ड्रग्स ले रहा हो, उसके कोई साइड इफेक्ट आ रहे हो.
ओके. ये सब तो कहने के रीजन है, लेकिन व्हेन आई हैव स्टार्टेड माय प्रैक्टिस, मेरा फर्स्ट थॉट तो वो रहता था, मैंने मेडिसिन तो सही दी या नहीं दी. यू आर कॉन्फिडेंट डॉक्टर्स, आपको ऐसा क्वेश्चन नहीं आ रहा है, दैट इज गुड थिंग. लेकिन मुझे तो फर्स्ट क्वेश्चन नहीं आता व्हेन आई हैव स्टार्टेड माय प्रैक्टिस.
आता है सर.
यार तो सच्ची बात निकालो.
सर स्टार है सर, 5 स्टार है ये तो. पहले वर्ड से पहले 5 स्टार क्वेश्चन था. हाँ यही तो है.
That is the feeling of every homeopath. That is the first thought of every homeopath. लेकिन कोई शेयर नहीं करता. लोग शेयर ऐसा ही करता है कि मुझे ड्रोसेरा से कफिंग मिटा, लेकिन पहले जो 4 मेडिसिन यूज किए उसके बाद चेंज करते 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 आप ड्रोसेरा पे पहुंचे हो. तो वो जो पहले का जो थॉट था, थॉट प्रोसेस, दैट नो वन इज शेयरिंग विद एनी होम्योपैथ. आपने स्पॉन्जिया प्रिस्क्राइब कर दिया, स्टिल पेशेंट इज नॉट रिस्पॉन्डिंग. आपने मेफाइटिस दे दिया, स्टिल पेशेंट इज नॉट रिस्पॉन्डिंग. आपने ब्लड रिपोर्ट्स करवा दिए, रिपोर्ट्स आर एब्सोल्युटली नॉर्मल. आपने एक्सरे चेक करवाया, एक्सरे इज नॉट नॉर्मल. पेशेंट इज शोइंग एलर्जिक कंडीशन, IgE इज इंक्रीज. नाउ व्हाट? नाउ यू हैव टू प्रिस्क्राइब सिम्प्टोमेटिकली ओनली. आपने ब्रायोनिया दिया, आपने ये दिया, आपने वो दिया, नथिंग इज रिस्पॉन्डिंग. तो मेरा तो फर्स्ट थॉट वही आता है कि मैं कुछ गलत मेडिसिन दे रहा हूं और उसकी वजह से आता है. That was the thought when I have started my practice. Why I am sharing with you? You just open your mind. अभी मेरा एक क्या हुआ था, इंटरव्यू हुआ था वन यूट्यूब चैनल के ऊपर. तो मैंने उसको बोला कि ससेप्टिबिलिटी और साइड इफेक्ट्स के बारे में जरा बोलना है होम्योपैथी के बारे में. तो नहीं नहीं सर ऐसा मत बोलना. अरे मैंने बोला कि साइड इफेक्ट्स है ही नहीं तो बोलना तो पड़ेगा ना. मैंने बहुत सारे एग्रावेशन देखे इन माय प्रैक्टिस. शी टोल्ड मी लाइक दिस. तो मैंने बोला अब तो मैं ये डिस्कस करूंगा. नाउ आई एम गोइंग टू डिस्कस इन द सेशन. और मैंने लाइव में डिस्कस किया और आई ओपन हर विजन. वो एग्रावेशन हमारे माइंड से होता है. दैट इज नॉट ट्रूली होम्योपैथिक एग्रावेशन. बिलीव मी गाइस, it is quite difficult to digest when we learn that susceptibility, when we learn that aggravation cancer observation. It is quite difficult to digest, but this is the fact. When patient came to you with aggravation, ask them, कुछ ऐसा खाया था, कुछ ऐसा पिया था. Don't claim them, लेकिन ask them कि आपने कुछ 2 दिन में खाया था कि जिसकी वजह से स्किन का एग्रावेट हुआ है. आपने 2 दिन में कुछ खट्टा खाया था, कुछ ऐसी चीज खाई थी. तो यू विल रियलाइज दैट दैट कैन बी द ट्रिगरिंग फैक्टर रादर देन आवर मेडिकेशन. Believe me, guys. This is the real fact. And like I gave you the example of coughing. So in that case of coughing, we got the aggravating factor that is EC inhibitor. तो रामीप्रिल जो पासे पीछे प्रिल वाली जो मेडिसिन आती है, those are the ACE inhibitor. तो ACE inhibitor की one of the main side effect is coughing, dry coughing. तो मैंने स्पॉन्जिया दे चुका था, मैं मेफाइटिस दे चुका था, I used ब्रायोनिया, was nothing was responding. And you check the Google, ACE inhibitor की side effect, open it, Google करो. आप में ऐसा है, लेकिन that is mentioned in book कि dry coughing which is not responding to any medication, that you will get in Google.
Cough medicine do not usually help for cough caused by Rami.
Yes, yes, दिखाओ. Side effects of Ramipil ऐसा लिखा है ना? हाँ, Google. हाँ, dry cough, that is side effect, okay. लेकिन which is not responding to any medicine, that is also mentioned. So that we have to kept our mind open. वो mind खुला रख के बैठना है. And then we talk to the cardiologist, and cardiologist basically he denied. Patient was taking yes, क्या लिखा है?
Cough medicine do not usually help for
Cough medicines do not usually help for coughs caused by Ramipril. So patient was taking beta blocker along with Ramipril. So we talked to the cardiologist, and cardiologist denied. That was new for us. कि when patient is taking beta blocker along with Ramipril, so that do not create coughing. That we learn first time in practice, and that is why I'm sharing with you. I don't know that concept is right or wrong, but that cardiologist explained us. कि when patient is taking beta blocker along with Ramipril, तो coughing नहीं कर सकता है. Let's see, we are still patient is on observation. जो ये week में हमारी medicine के साथ patient is not responding, तो I'm definitely going to reduce the Ramipril, and we'll show to the cardiologist if it is reduced or not. So such kind of mindset you have kept in your clinical practice. Open your vision. Anything can be the cause. Anything can be the triggering factor. वो used to मत हो जाओ कि viral coughing ये prescribe such medicine. Right, guys? Are you with me?
Yes, sir.
जाग रहे हो?
Yes, sir. Yes,
ऐसा
sir.
नहीं है? Yes, जागते रहो. So that is drug induced acne पे से बात निकली थी. Drug induced coughing.
Now the first is acne conglobata. Conglobata means a ball-like collection of a balls. Means large lump-like acne is there. Screen share हो रहा है?
Screen दिख रहा है, guys?
No, sir.
Acne conglobata is the severe form of acne in which the manifestation is like intercommunicating abscesses and sinuses. And these all types of eruptions are filled with serosanguinous fluid, means having the serum and the blood, also the filled with the pus. And the comedones are typically seen in this acne conglobata, and comedones are also multiporous, means having the multiple opening around the large acne. Acne conglobata is quite difficult to heal. It takes several months to heal, and when it heals, it leaves the deep scar, but deepest scar, deep pit, or sometimes it develop the hypertrophic scar, and joined by the keloidal breach.
ऐसे ही acne मिटाने में मजा आता है. And it shows better before after photos. Believe me. ऐसे acne जब मिटते हैं तो वो that create wonders. Keloidal acne है जो vulgaris है, तो मजा आता है.
Here is the picture. Acne conglobata, the large ball-like eruptions you can see. They are communicating, means they are close to each other, and they are generally filled with the serosanguinous, filled with the serum, filled with the blood and the pus. And when it heals, the breach of keloid are seen. Follicular occlusion syndrome. This is off topic. Do you guys want to learn this or I'll skip?
No, ma'am, continue.
Okay. Follicular occlusion syndrome is a group of disease in which the hair follicles are involved. So the common thing in this multiple group of disease are the involvement of follicle. Like one by one we can see. First of all, this group involving the acne conglobata, hidradenitis suppurativa, dissecting folliculitis of scalp, and pilonidal sinus. The common things of this group of disease is the occlusion or the clogging of the hair follicle. Here is the picture of hidradenitis suppurativa. This generally seen in those areas which are constantly under the friction, like the armpit, between the buttocks or in the groin region or on the breast. So having the painful pea-size eruptions and along with the multiple blackheads. You can see here the multiple blackheads. And in the severe cases, they develop a sinus in between. They are connecting two acnes or the two eruptions are connecting under with the sinus.
That is the inflammation of severe system, right?
Yes. So this is the hidradenitis suppurativa. The second disease is dissecting folliculitis of scalp, generally seen on scalp, and it is the also the clogging of the hair follicle, and the inflammation and pus are seen around the follicle, hair follicle. So in the extensive cases and when it heals, it leaves the scarring alopecia.
That is called as scarring alopecia.
Yeah, this is the previous picture, and after that, this is the after picture when it heals. It leaves the scar, and hair never grow in this region.
So this scar वाला before after नहीं है, ये scar वाला after का फोटो है. ये अच्छा होने के बाद वो scar create किया है.
Yes. And now the pilonidal sinus. Pilonidal sinus, the sinus developed at the end of the tailbone. The sinus are developed, and the sinus containing the hair follicles and skin. And later on, that superadded with bacterial infection, and the pilonidal sinus abscess are created. Here you can see in this picture, and the sinus is there. And when it is superadded with infection, it inflamed like this.
बहुत सारे पीट होते हैं उसमें, किसी को एक होता है, किसी को दो तीन भी हो सकते हैं. Hair are growing inside और hair are growing inside और उसकी वजह से that can occur. Or pilonidal sinus is completely a surgical condition. Homeopathy is not able to cure it, as the hair follicles are the triggering factor जो pus formate करते हैं. We can under control it. और medication से pus formation control आ सकता है, but which is not curable. I am treating one wonderful patient of that hidradenitis suppurativa. If I get chance, I will definitely share with you.
Yes, so this all come together and collectively termed as a follicular occlusion syndrome.
Let me try to share with you if I get it. हजरत ये शेयर करो तो चैट में जरूर. फिर हजरत आप नहीं हो मेरे. It is very painful condition, guys, and believe me, many doctors are against in homeopathy in this case, that she get almost cure.
According to the allied science, there is no cure.
According to allied science, there is no cure of such condition.
Only the symptomatic relief given to the patient.
Yes, and believe me, we got good result. Before after तो मैं आपको नहीं बता पाऊंगा, लेकिन बहुत सारी फोटोज है मेरे पास that I am going to share with you. Patient is, it is a severe form. You can just feel the pain of the patient from the photos. कोई आया रजत आपके पास? Did you share it? Rajat is sharing it on our chat box. You can see it.
Sinus इंफ्लेक्शन एरिया में सही जगह था।
इसमें follicles का inflammation होता है guys. There is no medication in allopathic science or allied science to cure such condition. कोई हुआ? अच्छा नेटवर्क यूज किया करो। फ्री वाईफाई देते हैं हम क्लिनिक पे, बिना पासवर्ड के नहीं देता हूँ मैं पासवर्ड। अरे ये मेरे व्हाट्सएप, यस आई विल शो, आई विल। अरे यार मेरा फास्ट है यार, वेयर इज माय व्हाट्सएप? चलो आई गॉट द फोटोज, सेंड किया आपने? मेरा फास्ट है।
आ गया मेरा।
Wait a minute guys, see, can you see it guys? This is the condition, this is the genital part of patient. Can you see it guys? Is it visible to you?
Yes, sir. Yes, sir.
See, hair follicles जहाँ पे, वहाँ सब जगह पे inflammation, severe inflammation. All surgeons are denied to cure such condition. And see, कितने before after का है वो मुझे पता नहीं. You can see the change. I'm treating such patients since 1.5 years. Definitely like to share जब भी ये cure होगा. I'm desperately waiting. Patient is under same remedy since almost 3 months. कोई changes नहीं कर रहे हैं. Patient is improving constantly. So no change is required at all. And you can see guys, this is the intensity. Inflammation of follicles. Patient is not even able to move her hand. She is not able to move. This is the thing.
सर कौन सी रेमेडी आप यूज कर रहे हैं?
I am using thiocyanine. I am using anthrax. I am using myristica TDS and Muxol that respond well in this patient. I have used Cilicia, almost half of Materia Medica, Heparsulf. I have used even acid floor. I have used many remedies. Lekin these remedies are responding well.